Every month, thousands of patients visited Lawson Health Clinics. Some came for routine checkups. Others arrived carrying fears they rarely shared with anyone. A troubling diagnosis, a painful symptom, an uncertain future. For many people, simply walking through the front doors required courage. The healthcare network surveys reflected that reality. Patients frequently praised the doctors. They praised the nurses. They praised the quality of care. But one detail puzzled Dr. Andrew Lawson. One name appeared more often than anyone else's. Not a physician. Not a specialist. Not a manager. A receptionist. Karen Mitchell. Again and again, patients mentioned her in survey comments. Some wrote that she made them feel welcome. Others said she made difficult days easier. One patient simply wrote, "She made me feel like a person instead of an appointment." Andrew Lawson had spent 30 years building healthcare clinics. And after reading hundreds of comments about the same receptionist, he decided he wanted to understand why. And before the week was over, one clinic manager would learn an important lesson about efficiency, and an overlooked receptionist would remind everyone what healthcare was supposed to be. The first patients began arriving shortly before 8 o'clock. Karen Mitchell was already at her desk. As always, a cup of coffee rested beside her keyboard. The computer screens glowed softly. The waiting area remained quiet. For the moment. Within an hour, every chair would likely be occupied. The phones would ring continuously. Schedules would change. Appointments would run late. Someone would forget paperwork. Someone else would arrive worried. Healthcare, Karen often thought, was one of the few industries where almost nobody arrived because they were having a wonderful day. She smiled as the first patient entered, an elderly gentleman carrying a folded newspaper, a regular visitor. "Good morning, Mr. Harris." The man smiled immediately. "Good morning, Karen. How's your granddaughter doing?" His face brightened. "She graduated last week." Karen's smile widened. "That's wonderful." The exchange lasted perhaps 15 seconds. No more. Yet Mr. Harris walked toward the waiting area smiling. Karen returned to her computer. To anyone watching, nothing important had happened. To Karen, it mattered. People liked being remembered. The morning gradually became busier. Patients arrived. Phones rang. Schedules shifted. The clinic settled into its familiar rhythm. A young mother entered carrying a toddler. The child looked frightened. The mother looked exhausted. Karen immediately noticed both. "First visit?" The woman nodded. "My son is nervous." Karen smiled gently, then pointed toward a basket near the waiting area. "We keep stickers over there." The child's eyes immediately shifted toward the basket. Within seconds, he was examining cartoon animals instead of worrying about the appointment. His mother visibly relaxed. Another small moment. Another small difference. Karen never thought of these things as extraordinary. She simply paid attention. Not everyone did. Shortly before 10 o'clock, Melissa Grant emerged from her office carrying a tablet. The clinic manager moved efficiently through the reception area, reviewing schedules, checking waiting times, monitoring patient flow. Melissa was good at her job. Very good. The clinic consistently ranked among the strongest performers in the healthcare network. Appointments started on time. Doctors remained productive. Patients moved through the system efficiently. Those results mattered, and Melissa took pride in them. As she passed the front desk, she noticed Karen speaking with an elderly woman. The conversation appeared pleasant, friendly, perhaps a little too friendly. Melissa checked her tablet, then glanced toward the growing line of patients. Karen Karen looked up. Yes? Melissa smiled professionally. Try to keep check-ins moving a little faster this morning. Karen nodded. Of course. Melissa continued walking, then paused. And remember, we don't need a conversation with every patient. The statement wasn't rude, at least not intentionally. But Karen found herself watching the manager walk away. Then she looked back toward the elderly woman standing at the desk. The woman appeared nervous. Her hands trembled slightly while searching for identification. Karen offered a reassuring smile. Take your time. The woman's shoulders relaxed almost immediately. Another few seconds. Another delay. Another person who felt a little less alone. Across the room, Melissa noticed the interaction and quietly shook her head. To Melissa, efficiency created better care. To Karen, care created better care. Neither woman realized it yet. But before the week was over, that difference would become impossible to ignore. The clinic remained busy throughout the morning. Patients arrived steadily. Phones rang. Appointments stayed on schedule. The reception area operated with the familiar rhythm of a well-run healthcare facility. Karen Mitchell noticed the man the moment he entered the clinic shortly after 11 o'clock. Years behind the reception desk had taught her to notice almost everything. New patients. Returning patients. Worried and confident patients. People rarely entered a healthcare clinic without carrying something. Fear. Or hope. Questions. Relief maybe. This man appeared calm. Well-dressed. Polite. He was carrying a small notebook. Nothing about him suggested he was different from the dozens of patients who visited the clinic every day. Nothing about him seemed unusual. And within seconds, Karen returned her attention to the next patient waiting at the desk. He approached the reception desk. Karen smiled. Good morning. Good morning. The man returned the smile. I have an appointment with Dr. Reynolds. Karen checked the schedule. Andrew Lawson? That's me. Karen nodded. You're a little early. The man laughed softly. I've been told that's a bad habit. Karen smiled. There are worse habits to have. The exchange lasted only a few seconds. Yet Andrew Lawson found himself smiling as he walked toward the waiting area. Not because the conversation had been remarkable, because it had not. Karen had treated him exactly the same way she treated everyone else. Warmly, professionally, without rushing, without performing. She simply paid attention. Andrew took a seat near the window, placed his notebook on his lap, and began watching. Over the next hour, he observed dozens of interactions. Patients arrived worried. Patients arrived confused. Patients arrived impatient or frightened. Karen greeted every one of them with the same calm professionalism. Not identical words. Identical respect. That distinction impressed him. Several times he noticed patients approach the desk appearing tense. Almost every person walking away from the desk looked calmer. He began making notes. Not about waiting times. Not about scheduling. Not about operational efficiency. About people. And the more he observed, the more curious he became. Because patient surveys had repeatedly mentioned Karen Mitchell. Now he was beginning to understand why. Around noon, Melissa Grant emerged from her office, tablet in hand, moving briskly through the clinic. She noticed Andrew sitting in the waiting area. Immediately she approached. Mr. Lawson? Andrew looked up. Yes. Melissa smiled professionally. I'm Melissa Grant, the clinic manager. The two shook hands. I hope everything is going well. It is. Andrew glanced around the clinic. Very well, actually. The compliment pleased Melissa. She had worked hard to create that outcome. Thank you. Andrew nodded. You run an efficient operation. Melissa smiled. We try. Neither of them realized it yet. But over the next 2 days they would discover that efficiency wasn't the reason Andrew Lawson had come. He had come to understand something much more important. Why patients kept remembering a receptionist long after they had forgotten everything else about their visit. The clinic remained busy throughout the afternoon. Appointments arrived and departed with impressive efficiency. Patients moved steadily through the system. Waiting times remained low. Schedules stayed on track. From a management perspective, the day was nearly flawless. Dr. Andrew Lawson sat quietly in the waiting area. A clipboard rested on his lap. A visitor badge hung from his jacket. To everyone around him, he appeared to be another patient waiting for an appointment, exactly as he intended. The longer he watched, the more impressed he became. Not by the building, not by the equipment, by the people. Nurses moved quickly without appearing rushed. Doctors treated patients professionally. Staff worked together smoothly. The clinic clearly deserved its reputation. And one person continued drawing his attention. Karen Mitchell. Not because she worked harder than everyone else. Because she noticed things everyone else seemed to miss. A man entered carrying an appointment card. Nothing unusual. Until Andrew noticed the man's hands shaking. Most people would not have seen it. Karen did. Before the man reached the desk, she was already smiling. Good afternoon, Mr. Harper. The man attempted a smile. It didn't quite work. Karen leaned forward slightly. Everything okay? The man hesitated, then shrugged. Just waiting for test results. Karen nodded. Not dramatically, not theatrically, simply acknowledging what he had said. I'm glad you're here. The man smiled weakly. A few moments later, he walked toward the waiting area looking noticeably calmer. Andrew opened the small notebook resting on his lap and made a brief note. Not because Karen had solved a problem, because she had recognized one. The distinction mattered. Later that afternoon, another situation caught his attention. A young woman approached the front desk, visibly upset, holding back tears. Karen immediately noticed. Melissa noticed as well. Melissa saw a patient creating a delay. Karen saw a patient having a difficult day. Karen quietly stepped away from her workstation for a moment, spoke softly, listened, allowed the woman to compose herself. The interaction lasted less than 2 minutes. When it ended, the young woman smiled, thanked her, then took a seat. Melissa looked toward the growing line in front of Karen's desk, not annoyed, concerned. As soon as the line disappeared, she approached Karen. Can I speak with you for a moment? Karen nodded. The two women stepped slightly away from the reception desk. Melissa lowered her voice. I know you're trying to help people. Karen listened. But we have to keep patients moving. Karen nodded. I understand. Melissa glanced toward the waiting area. We're responsible for hundreds of appointments every week. If everyone receives special attention, the schedule falls apart. Karen considered that, then smiled gently. I don't think people want special attention. Melissa waited. I think they want normal attention. For a moment, neither woman spoke. Melissa wasn't offended. If anything, she seemed puzzled. Because she genuinely believed she was helping patients. She simply defined help differently. The conversation ended politely. Both women returned to work. Neither convinced the other. Across the room, Andrew Lawson had witnessed the entire exchange. He found himself smiling, not because one woman was right, or because the other was wrong, because he had finally found the answer to the question that had brought him here. The clinic's success wasn't coming from a process, or a policy, or a management strategy. It came from attention. Two people trying to help patients in two very different ways. One focused on helping more people. The other focused on helping each person. The challenge wasn't choosing between them. The challenge was remembering which one came first. As the afternoon continued, Andrew closed his notebook. For the first time since arriving, he believed he understood why patients kept mentioning Karen Mitchell. Not because she performed miracles. Not because she broke the rules. Because in a building dedicated to treating illness, she never forgot to see the person who carried it. And before the week was over, that small difference would change the future of the entire clinic. 3 days later, clinic managers from across the region gathered for a quarterly leadership meeting. The conference room overlooked the city. Large screens displayed performance metrics from every Lawson Health Clinic in the network. Patient volume, waiting times, operational efficiency, scheduling performance. The numbers were impressive, especially for Melissa Grant's clinic. Several managers congratulated her. Excellent quarter. Your efficiency numbers are outstanding. The best in the region. Melissa smiled. She had worked hard for those results. Her team had worked hard. The recognition felt deserved. At the front of the room, Dr. Andrew Lawson reviewed several notes, then stepped toward the podium. The room gradually became quiet. Andrew smiled. Before we discuss next quarter's goals, I'd like to talk about something else. Several managers looked curious. Andrew changed the presentation slide. A single line appeared. Patient comments. The room became attentive. We collect thousands of survey responses every year. Andrew looked around the room. Most people think those surveys are primarily about medical care. He smiled. They aren't. A few managers exchanged puzzled looks. They tell us something much more important. Another slide appeared. The screen filled with patient comments. Dozens of comments. Several phrases had been highlighted. She remembered my name. She noticed I was nervous. She treated me like a person. She made a difficult day easier. She listened. The room became very quiet. Andrew allowed everyone to read. Then he asked, "Does anyone notice a pattern?" Silence. Finally, one manager spoke. "They're all describing the same employee." Andrew nodded. "They are." The next slide appeared. One name. Karen Mitchell. Several people looked surprised. Melissa most of all. Andrew continued. For several years, Karen Mitchell's name has appeared in patient surveys more often than any physician, nurse, or manager in this clinic. Complete silence. Not because anyone doubted him, because nobody had expected the answer. Karen was a receptionist, a very good receptionist, but still a receptionist. Andrew looked around the room, and that raises an important question. He paused. Why? No one answered, because nobody had ever asked this before. Andrew smiled. I spent 3 days in Melissa's clinic trying to find out. Now the room became even quieter. Several managers turned toward Melissa. She suddenly understood why Andrew had been sitting in the waiting area all week. He hadn't been visiting. He had been observing. Andrew continued. I watched doctors. I watched nurses. I watched administrators. Then he smiled. And I watched Karen Mitchell. A few people laughed softly. Andrew nodded. Here is what I learned. The room leaned forward. Karen does something remarkably unusual. Another pause. Then he continued. She notices people. Silence. The simplicity of the statement made it even more powerful. Andrew continued. When patients arrive, they are often frightened, confused, worried. Sometimes they are carrying news that may change their lives. The room listened carefully, and before they ever meet a doctor, before they ever receive treatment, someone has an opportunity to remind them that they matter. Many eyes drifted toward silently sitting Karen, who suddenly looked as though she wished the floor would open beneath her chair. The room smiled. Andrew continued. And Karen never misses that opportunity. Then Andrew looked toward Melissa. Not critically, not accusingly, respectfully. Because Melissa had done many things right. More than most people realized. The room remained silent. Andrew Lawson stood at the front of the conference room. Karen looked uncomfortable. Melissa looked thoughtful. Everyone else waited. Andrew smiled gently. Before anyone misunderstands me, I am not criticizing efficiency. Several managers visibly relaxed. Andrew nodded toward Melissa. Melissa Grant runs one of the most efficient clinics in our network. Melissa looked relieved. The compliment was genuine. Your waiting times are excellent. Your scheduling is excellent. Your operational performance is excellent. Andrew paused. And all of those things matter. Several managers nodded. Because they did. Patients did not enjoy sitting in waiting rooms. Doctors needed organized schedules. Clinics needed structure. Efficiency mattered. Andrew looked around the room. But efficiency is a tool. It is not the purpose. No one spoke, because everyone understood the distinction. Andrew continued. The purpose is the patient. Simple, direct, impossible to misunderstand. The purpose has always been the patient. He looked toward the screen displaying Karen's name. Over the past 3 days, I watched Karen Mitchell do something remarkable. Karen immediately looked embarrassed. Andrew smiled. She made frightened people feel less frightened. She made confused people feel less confused. She made difficult days a little easier. The room listened, and she accomplished all of that without a medical degree. A few people smiled. Andrew nodded. Because what people often need first is not expertise. It's reassurance. Silence. Then Andrew turned toward Melissa. Not as a judge, not as a superior, but as a teacher. Melissa. Yes. Then Andrew delivered the thoughts that had been forming throughout the entire week. You've helped this clinic serve more patients. Melissa nodded. That was true. Andrew smiled and continued, looking toward Karen. And Karen has spent years helping each patient. A pause. The clinic needs both. The statement was not dramatic. It was true. Melissa lowered her eyes for a moment, then slowly nodded. For the first time, she saw what she had missed. Not from Karen, from herself. She had become so focused on moving patients through the system that she had stopped noticing what they experienced while moving through it. The realization wasn't painful. It was enlightening. After a moment, Melissa smiled toward Karen. A genuine smile. "I think I owe you an apology." Karen looked surprised. "For what?" "For treating compassion like a delay." Karen considered that, then shook her head. "You were trying to help people too." Several people exchanged smiles. Andrew smiled too. This attitude was exactly why patients trusted her. Finally, Andrew looked around the room. "I'd like to make a proposal." Immediately, several managers smiled. They had learned that Andrew's proposals rarely remained proposals for very long. Andrew continued. "Every Lawson Health Clinic trains employees on systems, procedures, compliance, and technology." He nodded toward Karen. "I think it's time we also train them on presence. How to listen. How to reassure. How to make people feel seen." Andrew smiled. "And I can think of no one better to help us than Karen Mitchell." Karen froze immediately. Andrew continued. "With your agreement, Karen, I'd like you to help create a patient experience training program for every clinic in our network." Karen blinked. "Every clinic?" Andrew nodded. "Every clinic." The room erupted into applause. Warm, genuine, immediate. Karen looked completely overwhelmed. When the applause finally faded, Andrew spoke up one last time. "There is something I learned many years ago. People rarely remember every form they filled out. They rarely remember every instruction they received. But they almost always remember how they were treated." Andrew smiled toward Karen. "The first treatment a patient receives isn't medicine. It's dignity." And as the meeting came to an end, Melissa found herself thinking about the patients who would arrive tomorrow morning. The schedules would still matter. The waiting times would still matter. And efficiency. But perhaps there was room for something else as well. Something Karen Mitchell had understood all along. Sometimes the most important thing you can give a person is the feeling that they have been heard.